Hello, I am Elizete Kunkel from Brazil. It's a pleasure to participate in this event that addresses technology, industry, people, and economics. Today I'm going to talk about the challenges of inclusive innovation with additive manufacturing in Brazil. I am graduated in physics and my postgraduate course were in the field of biomedical engineering. After my PhD in biomechanics in Germany, where I lived for 7 years, I went back to Brazil to work with social innovation using technology. Currently, I am professor and researcher at the Federal University of São Paulo in the field of biomedical engineering, and I am the regional chair for Latin America of the Human in 3D Printed Group. I am coordinator in the research group on biomechanics and assistive technology. And our projects, we use additive manufacturing technology and innovation for social inclusion, such as a replacement lost parts of the human body. 3D printing is an emerging technology that has revolutionized manufacturing process. This technology changed the post-structural process structure and promote discussion involving innovation. Although this technology is not new in Brazil, just in the last 10 years, we are using it for application and society problems. Since in 2000, social entrepreneurships and social innovation have received a special attention from policymakers, academics, and professionals. And inclusive innovation is the development of new goods and services for and by marginal groups, including people with low incomes, disabilities, or special needs. So the field of social innovation also includes researches regarding innovation for people with disability. In this recent publication, the authors said that they found no example of inclusive innovation using 3D printing in Brazil. This study say that 3D printing technology is not being adopted by unserved communities because the technology is still expensive and requires a difficult learning curve. In fact, there are significant barriers that prevent technology from having a broad impact on the society. But today I will present two examples of inclusive innovation in Brazil that are coordinated in the university. The first one is the IJA project. This was a social and collaborative initiative created in March last year to meet a demand from society in the context of the COVID-19 pandemic. The goal of the IJA project was to produce and supply face shields at no cost to healthcare professionals who are working in the fight against the coronavirus. Our social problem was the lack of individual protection equipment for healthcare professionals who treat patients with COVID-19 in public hospitals in Brazil. And the solution was a face shield produced from open design model, also considering medical and production criteria by 3D printing. The IJA project was structured as a social innovation idealized on the group Women in 3D Printing and a medical team from Hospital São Paulo Unifesp. For their operation, we count on about 1,000 makers and many 3D printing companies, and we have the support of crowdfunding donations from individuals and companies. The name Egypt is inspired by the Greek goddess who represent health, cleanliness, and sanity associated with disease prevention. For the methodology, we used the 5 steps of design thinking They are empathize, define, ideate, prototype, and test, and that were implemented using the fused deposition modeling process of 3D printing. After many tests, we created a face shield model that could meet the requirement of comfort, safety, ease to use, and range. In addition to the 3D printing requirements that are FDM, we use it FDM process, material PLA and ABS, and maximum printing time of 1 hour. In the same time, three partners companies created a model using the EGL model to make using industrial injection process and increase the production capacity. These are the main features of our face shield, and it is easy of assembling, low cost of $1, light, flexible, and resistant, universal size, cleanable, biodegradable material, and we are using medical validation for Brazil. Brazil is the fifth largest country in the world, so the biggest challenge of the project was to do the mass production and deliver logistics in a quarantine. This was the main steps. First, the analysis of face shield requests of the hospitals, definition of required demands of the face shield by planning sector, request of a collection of 3D print frames from the makers and delivered to the assembly hub, assembling the Asia face shield, transportation of the face shields by partners, transportation company, and delivery of the face shields to the public health institution. After 3 months, we produced and donated 1,500 face shields to all states in Brazil, and the face shields were produced through the FDM process, 3D printing, and injection molding process in regions without 3D print makers. The distribution point was the city of São Paulo, and all regions were served by land, sea, and air transportation of partner countries. After 3 months, we have these results, and we don't have the exact number of how many professionals received our face shields and how many of them were protected against COVID-19 using this device. But we know that we were able to serve all hospitals that requested this device in Brazil, and that they would have not other option due to the lack of resource and device on the market. So the EJA project generated research of about $600,000. About this project, we wrote a paper describing in details, and the paper is available in internet in a preprint version. The second social innovation that I want to show is the project Mão 3D, which literally means 3D hand. The goal of the Mão 3D is to produce and supply upper limb prosthetics and rehabilitation with no cost to children and adults who need the assistive technology device. Our social problems is that in Brazil, about 25% of the population is considered disabled. Of this 25, 7% of these people have physical disabilities. Also, children who are born without the upper limb or amputation due to an accident or illness do not have access to prostheses and must suffer from social exclusion. And the solution for these problems would be an upper limb prosthesis, light to wear, vegetable, beautiful, produced from open design using telemedicine and considering medical and production criterion by 3D printing. Montreux is a social impact initiative based in other initiatives enable and team unlimited. And for operation, we count on Unifesp internal and external volunteers, graduate and postgraduate students. And we have the support of external collaborations in 3D print companies. As in the IJA project, the 5 steps of the design thinking methodology emphasize, define, ideate, prototype, and test were also implemented in the Montreux using the FDM process. Using the open model of mechanical processes, we have developed different protocols for each step of the process to make and processes and for the rehabilitation process. This way, we reduce the errors associated with the FDM process using low-cost 3D printers. The protocols are user selection, psychological support, 3D definition, acquisition of measuring, 3D modeling and printing, assembling and quoting, and rehabilitation. In addition to the mechanical processes, we are developing models of static and myoelectric processes that can be developed and low costed per 3D printing, reaching more people in need. Moreover, we are improving our rehabilitation process using the 3 kinds of processes. These are the results of our social impact and inclusion of people with upper limb disabilities. Here are some children from different cities in Brazil who received the prosthetics device by Montreux. Many of these children improved their self-esteem and started to perform activities that they would not be able to do without an prosthesis. So I will finish my presentation talking about important factors for development of assistive technology devices using additive manufacturing. The first one is about costs. The development of this device is perceived to be marginally cost effective. The market for people with disabilities is small and highly fragmented, and most small companies have limited capacity for technological innovation. Public financial models often do not work, and strong financial partners are needed. There is also a lack of ongoing support for development of assistive technology devices in the perception that device is for all is too costly. About the knowledge, most companies don't have knowledge gap. Most companies do have knowledge gaps for development of assistive technologies, lack capabilities and tools to practice inclusive design. The other question is the need to understand the user needs. There is a lack of active engagement of the end user during the development of an assistive technology device. Most companies are unaware of their customers' needs, and some people with disabilities are not even involved in the selection of their own assistive technology device, like a prosthesis. About the honorities of the opportunity. Both manufacturers and consumers have misperceptions of additive technology. This includes being unaware of the possibilities for technology transfers and the market potential, or about the cost and benefits of innovation. More important topics is about marketing. It is important to understand the market needs and possible dissemination channels for the user. And important is important. for the user, the consumer, sorry, it's important that additive technology can be trusted. About the user involvement, too often additive technology is built based on assumptions or if it work or not. The lack of active engagement of users results in the realization of rejection of the device by consumers. Involving the end user in the development of a technology helps firms be aware of market needs and constraints. People with disabilities need to be involved in all steps of the development of new technologies. About the technical training and support. Developers and users need adequate training to practice inclusive design and for optimal use of the assistive technology by end users. And the last is about the intersectorial cooperation. A driver of inclusive innovation is the formation of a multifaceted network consisting of various stakeholders. This way, different barriers can be communicated and removed. Here are our contacts about the two projects that I presented and my Instagram. To finish, I would like to say that in Brazil, we are in the new era of inclusive innovation using 3D printing technology. I would like to thank all those who helped us in this endeavor. Thank you.